Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? Hey, this is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. And folks, this is episode 257 of the Everything Medicare Podcast. And we're officially in October. Every single week, my company brings you a podcast episode where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And again, this is episode 257. Folks, we're officially in October, which means we are literally a few weeks away from the start of the Medicare annual election period, better known maybe as the Medicare open enrollment period, right? The Medicare annual election period, AEP for short. And folks, there's some stuff that you need to know, right? Essentially, on October 1st of every single year, changes are announced for the upcoming year, right, for January 1st for 2022 in this scenario, for Medicare Advantage plans and Part D prescription drug plans in terms of what kind of changes they're going to be going through for the upcoming year. So they announced them October 1st. You have essentially from October 15th through December 7th to make changes to your plan. If you either, one, don't like your changes, two, maybe there's a better plan that became available that wasn't available before, or three, maybe you just didn't like your plan, period, for throughout the course of the year. This is the time period that you're going to have to be able to make changes on your plan. So what do you need to know? Well, in my opinion, in terms of what you need to know is, first of all, it's going to depend on kind of what plan you're going to have. What plan you have currently, I should say. If you have a Medicare supplement or a Medigap, like a Plan G, a Plan N, a Plan F, your plan is not going to be experiencing any changes. That is a fact. Medicare supplements are unimpacted by open enrollment. Medicare supplements can be changed any time of the year. There's not any specific time period that you have to change and can't change any other time of the year. The only criteria to be able to change from one Medicare supplement plan to another in most cases is you typically have to be able to pass health questions and underwriting, unless you live in a state that does something like a birthday rule where you can change on the month of your birthday with no health questions. And so essentially, folks, what you're going to be looking at is Medicare supplements are unimpacted. Now, typically people that have Medicare supplement plans also have Medicare Part D prescription drug plans. Now, the reason why this is important is because your Medicare Part D prescription drug plan is separate from your Medicare supplement. Because if you have a Medicare supplement plan, its only job, really, folks, is to pay the 20% that Medicare leaves behind. It doesn't do anything else. It pays after Medicare. It pays as a secondary. If Medicare pays in a claim, the supplement will pay in a claim. If Medicare doesn't pay in a claim, the supplement will not pay in a claim. And so on and so forth. Original Medicare Parts A and B, if it's your primary insurance, does not cover dental, vision, hearing, prescription drug coverage. So neither does your Medicare supplement plan. So that's where you have individual, standalone Medicare Part D prescription drug plans. Individual Medicare Part D prescription drug plans, they do go through changes. They do get better, worse. The premium might go up or down. The deductible might go up or down. The copays might change. The formulary might change. You might have a prescription that's covered as a Tier 2 in 2021, but in 2022, it might be covered as a Tier 3, which, of course, the higher the tier your prescription is placed into, the higher the copay it's going to be. So it's not a bad idea if you take any large amount of prescription drugs or any expensive prescription drugs to probably have your plan compared. If you just take a couple of cheap prescriptions, like let's say you take a lisinopril, an omeprazole, a losartan, a levothyroxine, just some real inexpensive, generic, commonly used prescription drug, and let's say your premium hasn't shot up through the roof, let's say it wasn't $20 this year and went up to $60 for next year, as long as something like that is not transpiring, you probably don't need to worry about it, truth be told. Because some of those cheap prescriptions are going to be covered very well with any plan. Could you maybe save $5 a month, something like that? Maybe, but is it worth the aggravation? Is it even worth the time? Some people would say no. Some of you listening might say yes. But that's really the only thing you have to worry about when it comes to Medicare supplement plans. Now, if you are on a Medicare supplement plan and you have a desire to switch your plan to a Medicare Advantage plan, this is the time to do it. This is the only time of the year that you can do it. And here at our office, we work really hard. We work incredibly hard to make sure that we're keeping up with your needs, with all of our clients' needs all year round. And we're going to be in a grind mode, folks. We're going to be in a very hard working mode for the next 2 months or so. Because we're going to be bringing you shows every single week. That's the goal. I know throughout the year there might have been some weeks here and there where we were sporadic, where we might have not brought you a show. Got to understand, folks, I've said it before and I'll say it again. We are an insurance agency. We're not a radio station. So we bring you shows when we can. Now, over the years, we've been very consistent. In fact, as recently as last year, we were doing 3 shows a week like clockwork. But now we're down to 1 show a week. And for the most part, I think we're pretty good at being consistent on those shows. But we are now in a position where during open enrollment, I think there's a lot for you to know. I think there's a lot you need to know. And I think this is something that you're going to need to essentially need to hear week in and week out every single Monday throughout open enrollment. You're going to see a lot of advertisements. You're going to see a lot of TV commercials, right? You're going to see Jimmy J.J. Walker on TV now, doing his best Joe Namath impersonation. You're just going to see Joe a lot. You're going to see all these TV ads. 99 out of 100 of them are talking about Medicare Advantage plans. That is the truth. What I would say, folks, that's important for you to keep in mind is Medicare Advantage is really what is the heart and soul of the Medicare annual election period. Yes, the Part D prescription drug plans are impacted and they should be checked on in certain situations, and there's going to be situations where some of you might need to change your Part D prescription drug plan. However, I've gotten this bad habit lately, folks, where I've started to drink some Red Bulls. Just because, I'm when I started this show, I think I was 24, maybe 25. I think I was 25, actually. I'm now 29. And, I've just been trying to make sure that I can keep up with everything for all of you. So I've been in this bad habit of drinking Red Bulls. I know they're going to kill me. Haven't drank a lot of them, and it hasn't been very recently. I'm going to probably not have any more after today. That's what addicts say, right? But here we are. Anyway, folks, Medicare Advantage is what you need to be aware of, in my opinion, more than anything else for the Medicare annual election period. Because Medicare Advantage plans have so many different working parts and different variables. What is a Medicare Advantage plan if you're new to the show? Well, a Medicare Advantage plan is essentially a plan that instead of supplementing Medicare, instead of paying after Medicare, you run your Medicare through a private insurance company. And they take over the responsibilities for your claims. So Medicare doesn't have to anymore. That takes a big burden off of Medicare's shoulders, as you might imagine. So, in exchange, Medicare agrees to fund this insurance company every month to take care of you. And they get quite a bit of funding. And that's how you're able to get Medicare Advantage plans that are $0 premiums. You see all those advertisements for $0 premiums, that's how it's possible, because they're getting funded by the government. Your mother probably told you growing up, nothing in life is free, right? True. Nothing in life is free. It's being paid for by someone else if it's not being paid for by you. But Medicare Advantage plans, if you have one, have a lot of different working parts, right? So let's kind of walk through them together. So they have networks of hospitals and doctors. Typically, Medicare Advantage plans are going to have networks. Some have great big networks. Some have itsy-bitsy tiny networks that restrict you on where you can go. Some have more restrictions than others. Some have referral programs where you have to get a referral from a primary care physician to see a specialist. Some do not. Some are HMO plans where if you go out of network, unless it's an emergency room or some other very unique situation, you're not going to have any coverage in a lot of cases. Some are PPO plans where if you go out of network, you still are covered, but they cost you a higher cost share. Some have better medical benefits than others, higher copays, higher max out-of-pockets. Some have better dental, vision, hearing than others. Some have better formularies based on your prescription coverage, meaning they'll cover your specific prescriptions better than others. There's a lot of different working parts, and all of those can potentially change for your particular Medicare Advantage plan. Now, if you have a Medicare Advantage plan, you should have received what's known as an ANOC in the mail in the last couple of weeks. An ANOC stands for an Annual Notice of Change. What this means is essentially it's going to show you side by side the changes on your current plan from this year to next year. This is very helpful because they're side by side, right? The 2021 benefits on the left, the 2022 benefits on the right, side by side. It might say, okay, your max out-of-pocket was $3,000 this year. Next year it's going to be $3,300 or $3,500. And that's a very easy way to look and kind of see, is my plan getting better or worse? If your plan's getting better, that's great. If you're happy with your plan and there's not much changing, is there any necessarily huge need for you to change it? Probably not. There's a lot of advertising going on. It scares people. There's a lot going on. It makes people think they're going to miss out on a golden opportunity. But what is it at the end of the day? It's advertising. They're trying to get your business. They want you to feel like if you don't call them, you're going to miss out on something. That's what they want. That's what advertising is all about, to build a sense of urgency. But not everybody on Medicare should change their plans this AEP. Some of you should, yes. But not all of you should have to. And some of you might change just to change because you get so caught up in the hype of it all and the propaganda of it all, and you might end up on a worse plan than you were before, just because you were looking to change just to change. Changing for the sake of changing is not something that I recommend. Now, I'm not telling you not to change if your plan's getting worse or if there's a dramatically better plan in your area. It might not be such a bad idea to look into those things. But if you like your plan, it's not changing much, there's really no need for you to run out and change, because most people don't like change. Some of you might like it. Some of you might be oddballs. But most people don't like change. Most people get accustomed to things, and they really, for the most part, don't like learning a new system, a new way of doing things, a new insurance company, right? Because every insurance company's got their own policies and they do things a little bit differently than each other. The main thing I would tell you is Part D prescription drug plans, Medicare Advantage plans, they will go through changes. Read your ANOCs. It's going to tell you 90% of what you need to know in terms of if you need to make a change. And make sure that you don't get caught up in the hype, the hoopla. Don't call the TV commercials. It won't end well for you, I promise. There's time and time again where I can give you examples where the people that you actually get on the other end of the phone are not qualified to help you. They don't know what they're doing, and I wouldn't call them. I think it's stupid to call them. And the best thing you can do, in my opinion, and I've said it many times, is work with an independent broker who actually can help you, not a call center. Folks, we're going to be bringing you episodes every Monday, so do not miss them. We're going to be bringing some really great information, and I'm really excited about it. But my company's licensed in about 43 states. We're licensed in a lot of places now. If you'd like to call and see if we can help you, my office number is 801-255-5340, 801-255-5340. And if I can't help you myself, likely I know somebody in your area that can. or there might be someone that works with my company that lives in your area. We work with agents all over the country now. We actually have people that work with our organization. We can hook you up with them, worst case scenario. But we'd love to help you internally as well, and we definitely can. 801-255-5340, Christian Brindle Insurance Services. I put our Medicare knowledge and expertise up against anybody. And we have a very high customer satisfaction rate, and we help people all over the country. But even if you don't call us, if you just follow what I told you in this episode, I think it's going to start you off on the path to making some good decisions this annual election period for your Medicare plan. Anyway, folks, thanks so much for watching. Thanks so much for listening. However you might be consuming this episode, I really appreciate it. I'm so excited for the episodes we have to come. And I hope this episode really helped you out a lot. If you're listening to us on a platform that allows you to do so, please, please, please leave us a 5-star review if you enjoyed this episode. It would really mean a lot to me. And it helps us reach more people just like you. Helps with those podcast algorithms. If you're listening on a platform that allows you to do so, we probably broadcast on 20 different websites, so not all will allow, and I understand that. If you're watching on YouTube, please like this video. That helps with the YouTube algorithm, right? We record this show on video for those of you that might be interested in seeing my face as I talk. It's a little bit of a horror show as we get close to Halloween. And thankfully, my 2.5-year-old daughter doesn't look like me, right? She looks like my wife. But that's a story for another episode. If you're watching on YouTube, make sure to subscribe to our channel. We put out a lot of additional videos with information other than this show, and I think you'll like them. Thanks so much for watching, folks. Have a great rest of your week. Have a great annual election period. We'll be back next Monday, and until then, happy Medicare.